Hello, Dr. Garber. Hello, peers. I'm trying to work this video, so I hope it come out right. My name is Sonja Collins Scott, and I will be doing the presentation video submission on assignment 5-2. According to the article, Rogers believed that in order for psychotherapeutic change to occur, the following conditions must be present and must continue over a period of time. In other words, there must be a psychological contact between the participants. In his view, change can occur only in the context of a relationship. The therapist expresses acceptance or unconditional positive regard and has an accurate empathetic understanding of the client's feelings and experiences. However, the final condition states the client must perceive the therapist's acceptance and empathy, because if the therapist's attitudes are not communicated in a manner that the client experiences or perceives them, then from the client's perspective, they do not exist. Rogers' fundamental assumption is the belief that humans have a self-actualizing tendency and that it is crucially important for the therapist to create conditions that allow that tendency to flourish. This is essentially synonymous with the control mastery concept that patients come to therapy with an unconscious plan to solve their problems and to find solutions to their problems. However, the therapist's primary role is to help the patients carry out the plan. Therefore, I do not agree with Rogers' fundamental assumption when it comes to all clients. I do believe that clients come for therapies with an unconscious plan and they need help and assistance with finding solutions to their problems. And I believe that clients are individualized and some problems are more severe than others. In other words, Rogers' model does not adequately consider the role of patients' factors in therapeutic change processes. Patients clearly differ in their abilities to utilize treatment, and such differences account at least to some extent for therapeutic changes. Patient factors such as motivation or readiness for change, level or quality of attachment style, reality testing, emotional regulation, and severity and chronicity of problems all play some role in predicting therapy outcomes. Yet, Rogers' model does not take such important patient factors into account. I believe that Rogers' fundamental assumption is based on some sort of control, and the client should have a voice in their treatment or change process. Furthermore, clients should go through the stages of change at their own pace. For example, some treatment providers believe in total abstinence from all mood-altering chemicals and will threaten the client or use leverage to get the client to quit using drugs or drinking whatever immediately, when some clients don't want to stop all at once and want to utilize the harm reduction approach or the client-centered approach to bring forth treatment outcomes. And by being a therapist for many years, my experience is that the stages of change is good because each stage is where the client continue to grow. The client might not grow at the clinician pace, but they do grow at their own pace because it allows them to have some type of participation and engagement in their own process, while other clinicians, they want them to do what they want them to do and when they want them to do it, and that's what allows a lot of clients to rebel and get defiant, and they don't want to complete treatment and they quit. But allowing them to set their own goals and work at their own pace will get measurable outcomes. Thank you.